Today we're going to reveal the truth. What is it about mini facelift surgery? Well, what is a mini facelift? Well, it's really something that is suitable for someone who has mild aging. There's minimal changes like in the neck area, and there's minimal kind of loose skin, and so there's some effect of gravity, there's some deepening of the nasolabial lines, the lines that shadow from the nose to the mouth, and then maybe just subtle mild jowls. So this lady came to see me, one of my patients, where she had mild to moderate aging, and really the neck was a pretty good area, but there were these kind of shadows, nasolabial lines, marionette lines, and minimal changes in the neck. And so we're able to do a mini facelift, which means hiding the scars within the hair, around the natural curves of the ear. This area is called the tragus, so hiding behind the tragus, which means the scars are less, which generally is favorable because healing is faster. Now, my personal technique is I like to release the ligaments that tend to cause these lines with aging, and that's called a modified vertical deep plane facelift because it's lifting the deeper soft tissues, and that tends to improve the nasolabial folds and the marionette lines and really gives this kind of V-shaped appearance that makes people look younger. So to do that, we need to release the ligaments that lie in this kind of area and lift things up towards the zygomatic arch or the cheekbone, and there's an area here where we can lift up, which will restore the more V-shaped face of youth. So you can see in this patient of mine, another patient of mine, where this areas tend to come down. There's a deeper shadow here called the nasolabial fold. There's a deeper line here called the marionette line. And we can see afterwards, well, her face is just more V-shaped. And that means this area is lifted upwards. When is a mini facelift not helpful? Well, it's really for patients who need an additional neck lift. They have more changes in the jowls, deeper lines, deeper shadows, and more changes in the neck. And this means more loose skin, and really these patients, they need to get the very best result, they need a facelift and a neck lift procedure. So this is another one of my patients, and we can see these kind of bands in the neck. There's more effects of gravity, and that there's more changes in the jawline and jowls, and afterwards when everything is lifted up, the neck is improved, the jawline is improved, and this patient looked far fresher but completely natural. Another patient of mine, well, this lady, minimal changes in the neck, but we can see these kind of subtle changes in the jowls and in terms of the marionette lines, and afterwards this area is beautifully restored. Now, sometimes gravity is often the most important thing, and that's kind of mini facelift and lifting everything upwards. But sometimes we also need to add a little bit of natural volume like fat transfer. Now, where can this go wrong? Well, we've all seen celebrities, Katie Price is one, who've had multiple procedures because it hasn't really given her the results she wants. And sometimes trying to do a mini facelift when you need a face and neck lift procedure is just not going to deliver the results. Most of the healing is in the first couple of weeks after surgery, particularly the swelling, and although there are things that we can do to enhance how quickly a person recovers, and that might be massage, pushing away the swelling, lymphatic drainage, it might be a type of medicine, anti-inflammatory medicine. All of these things can be used, but there's always some degree of recovery even after a mini facelift procedure. There's no procedure that has zero risk and zero complications, and the most serious aspects of facelift surgery include things like skin necrosis, scar issues, stretching a motor nerve, and although these risks are really quite small, they're like approximately 1 to 2%, there's no way of 100% avoiding these things. Have you smoked, for example? Because if you have, well, that can be a risk factor for things like delayed healing, also known as skin necrosis, and we can use oxygen therapy to heal your face faster with surgery that minimizes those kind of risks and enhances recovery. And of course, there are things that we can do to manage scar issues. If you've had keloid scarring elsewhere in the body, then we need to be really careful about any scars in the face and neck areas, because we need to minimize those scars, hiding the scars in certain areas, being really proactive with anti-inflammatory medicines. All of these things are important. So in conclusion, mini facelift surgery, it's just not suitable for everyone. Like the truth is, it can be very helpful for younger people with mild facial aging, but if there's a more significant aging, then sometimes you just need to have a more complete procedure of facelift that's going to include taking away more of the loose skin and looking at the neck. I do hope this information has been helpful for you. Thank you so much for watching.